Yes.
Hi, Mr. Wadsworth.
Yes.
Hi, can I come in?
Sure.
So my name is Kathy, and I'm your nurse practitioner today.
Okay.
So for the record, could you just tell me your full name?
Benjamin A. Wadsworth.
Mr. Wadsworth, how do you prefer to be addressed?
By Ben.
Okay, so I'll call you Ben then. So you are a new patient for me. You're new to this practice. So I'm going to go through several questions and then we'll talk about why you're here and then see what we can do to help treat you today.
Okay.
So let's just find out real quick. You primarily speak English.
Yes.
Okay. And what is your age?
40.
And your date of birth?
April 22nd, 1980.
Okay. And then where were you born at?
Richmond, Indiana.
And how do you identify? What gender?
As a man.
Okay. And then the race that you identify with?
Caucasian.
Are you married or single?
Married.
Okay. And then what about your ethnic or cultural origin?
Jewish.
And what's the highest level of education that you completed?
Associate's degree.
And then what is your job?
Maintenance.
Okay. And then, so do you carry commercial insurance then with your job?
Yes.
Okay, great. All right, so let's talk about what brought you here today. Why did you decide to make an appointment?
Knee pain.
Knee pain, okay. So let's talk a little bit more about this knee pain. When did it start?
In high school.
So about how many years do you think that's been?
25.
Okay. So which knee is it? Is it one knee, both knees?
My right knee.
Your right knee. And then can you just point for me, like exactly where you feel that pain? Okay. So would you consider that kind of the outer knee area?
Yes.
Okay. So now this has been hurting for approximately 25 years. So does it hurt every day, all day? Like, tell me a little bit about the frequency of this pain.
Just off and on. Depends on what I'm doing.
So off and on, depending on activity.
Mm-hmm.
Okay. So tell me about how this pain feels. Can you describe it? Like, does it feel sharp or dull?
Sharp aching pain.
So a sharp aching pain. Okay, so what makes your pain worse? Like, what brings that on?
Certain activities like running, on my feet a lot, stuff like that.
Okay, so then what makes it feel better? Is there anything that you do that helps lessen the pain?
Yeah, because it hurts when I lay down too.
Okay, so
if I straighten it out for too long, it hurts.
Okay. So it hurts during rest as well. Okay. Now, does this pain radiate anywhere? Does it stay in that general area?
Just right in the same area, right here.
Okay. And we talked about how the pain seems to worsen during certain activities like running and being on your feet. So let's talk about the severity of your pain. If you could rate your pain on a scale of 0 to 10, 0 being, oh, it doesn't hurt at all, and 10 being like the worst pain that you've ever felt, where would you put that pain level at?
About a 7.
Okay. And is it almost always then at a 7, or are there times when it's less or more?
It could be less or more.
So when does the pain feel less? When you're at rest or?
When I haven't worked it out for a few days.
So when resting for a few days, it's less pain.
Yeah.
And then it hurts more.
With multiple days of activities.
With multiple days of activity. Okay. All right, so let me just make sure I have everything correct here. So you've been having this knee pain for about 25 years, basically since high school. It's your right knee, and it seems to be kind of in that outer area of the knee. And it kind of hurts all the time, but based on activity or rest, it could be a little bit more or a little bit less painful. You describe your pain as a sharp, aching pain. Again, it hurts a little bit more with additional activity like running or standing on your feet, but then sometimes it's a little bit better when you've had several days worth of rest. And you rate it at around a 7 most of the time. Does that seem like we've pretty much summarized that?
Yeah.
Okay, very good. So now we're just going to go through some past medical history. So let's talk a little bit about any major illnesses that you've had during your lifespan. And we're going to talk some about injuries, hospitalizations, and things of that nature. Do you have a history that you know of diabetes?
History on both sides of the family.
This is just your personal.
No.
Okay, so not for you at this time.
No.
What about hypertension, high blood pressure?
No, I've done more.
And as far as you know, hepatitis? How about asthma?
No.
And no problems with HIV?
No.
Okay, so can you tell me about any major injuries that you may have had?
No.
No major injuries. Have you ever had a blood transfusion? And have you ever been hospitalized?
No.
Overnight as an inpatient or observation? Okay. So let's talk a little bit about childhood illnesses. Now, can you recall if you've ever had measles, mumps, rubella? Did you have chickenpox? When did you have chickenpox?
5 or 6.
Have you ever had pertussis?
No.
Okay. And what about strep throat?
Yes.
Do you recall when you've last had strep throat?
It was a few years ago.
Okay. Now let's go on to talk a little bit about your surgical history. What surgeries have you had?
I had a vasectomy and a cyst removed from my finger
Okay. When did you have your vasectomy?
in 2003.
And then let's talk about this cyst on your finger. When did you have that removed?
Last year.
And which finger was that?
My right pinky finger.
And then what do you know about that cyst? Was there any concerns about it?
No.
Okay. Okay. Now, I just kind of want to review with you a little bit about any immunizations that you have had. Are you up to date on your immunizations such as tetanus, pertussis, diphtheria?
Probably not.
What about polio, measles, mumps, rubella? Many of these immunizations you would have had as a child.
Right, yeah, I got all those.
Okay. Have you had your influenza vaccine for this flu season?
No.
Okay. All right, so I'm just going to ask you a few questions about any psychiatric history. So as a child or an adult, have you ever been treated for or have a history of any type of psychiatric hospitalization or treatment of any type of bipolar disorder or anxiety or anything of that nature? Okay. So let's talk a little bit about your allergies. Do you know of any allergies to any medications, foods, anything of that nature? Okay, very good. And then I'd like to ask you a couple questions about your medications. Do you take any prescription medication?
No.
Okay. Do you take any over-the-counter medications? Anything that you're using to try to alleviate any of that pain that you're having in your knee?
Ibuprofen every now and then.
Okay. About how many milligrams would you say that you take?
Oh, I have no idea. Take 3 pills.
Okay. So we'll talk a little bit about looking at medication labels as well here after a bit. Do you take any herbal supplements or any vitamins or anything of that nature? Okay. Now let's go back to that ibuprofen. Do you take ibuprofen every day, several times per day?
Just every now and then.
Every now and then. Okay.
Maybe 2 days a week.
2 days a week. Very good. Okay, so when was the last time you had a full physical?
25 years ago.
How about an eye exam?
Year before last.
How about the dental exam?
Right before COVID, so back in February.
Have you ever had any screenings such as hearing? Have you ever had an EKG or a chest x-ray?
I had an EKG
Okay, do you recall when you had that?
in 2003.
And then was there any concerns with the EKG?
Yes, there was an irregular heartbeat at first, but it never duplicated.
Okay. Did you follow up with that at all?
Mhm.
Okay, and what was the result of that?
Clean bill of health, and say never could duplicate it.
Okay. Okay, and then have you recently had any type of blood work done to check your cholesterol levels, prostate exam, any type of stool examinations or anything of that nature?
Mhm.
Okay. Okay, so now we're going to move on and just talk a little bit about family history. So when I talk about immediate family members, I'm asking you about your biological grandmother and grandfather on both sides of your family, and then also your biological parents, as well as if you have children, I would be asking questions about that as well. So parents, grandparents, spouse, and children, is there any history of hypertension?
Yes.
Okay, who has hypertension?
My father died of a heart attack.
Okay. Do you know then, did they talk about coronary artery disease with your father or anyone else in your immediate family?
No, I think there's just more blockages and stuff like that, and hypertension.
Okay. Do you know if anyone in your family has elevated cholesterol levels? Okay. Has anyone had a stroke? Are there any family members, mom, dad, grandparents, children who are diabetic?
No.
Okay. How about thyroid problems or any problems with the kidney?
No problem.
Okay. Anyone with arthritis?
Dad had it.
Okay. Anyone diagnosed with tuberculosis or any type of asthma or lung diseases?
Tom, my brother, has asthma.
Okay. How about headaches?
I get headaches.
You yourself have headaches.
Mm-hmm. Me and my daughter both claim to have migraines all the time.
Okay. How many children do you have?
2.
And are they boy and girl or
2 girls.
2 girls? Okay. And then so which daughter is this?
Kaylee, the oldest.
Okay. Anyone with seizure disorder?
No.
Mental illness?
No.
Anyone with a history of suicide or suicidal ideations that you're aware of?
Mhm.
How about substance abuse?
No.
Okay. Do you know about any allergies of your immediate family members?
I think my mom has like pollen allergies.
Okay. No medication allergies from any of your immediate family members?
No.
Okay. So, how about, does anybody in your immediate family, so grandparents, mom, or your dad, have any symptoms with their knees? Did they have knee pain?
My mom.
Okay. And anyone in the family have colon or prostate cancer?
Yes. My grandpa.
Would this be your paternal or maternal grandfather?
Maternal.
Okay. And then, are you aware of any genetic diseases, genetically transmitted diseases that run within your family?
No.
Okay. Okay, and then I noticed when you mentioned that your father had passed away of a heart attack. So is your mother is still living,
Mhm.
and your children are still living? Are your grandparents are
They're all deceased.
okay? All right. So now we're just going to move on and talk about a few more personal things here. How we kind of talked about earlier about your cultural and ethnicity, and you stated that you were Jewish. So you identify as Jewish. Do you attend services regularly?
No.
Okay. So what is your overall feeling or rating? How do you perceive your overall health?
Pretty good.
So you feel like overall,
Mhm.
with the exception of this new knee pain or this old knee pain that you've been having, you feel pretty healthy. Okay. All right. How's your appetite?
Pretty good.
You have a good appetite. Are you
Eat more than I should.
okay? So you feel that you eat a little, you kind of
Indulge
okay.
frequently.
Okay. Are you satisfied with your current weight?
No.
So have you had some recent weight gain?
Man, not recent, but over the years.
Okay. So when you say that you're not necessarily satisfied with your current weight, what would you like to change about that?
The number on the scale.
So you'd like to maybe
Yeah.
lose a little bit of weight?
Yeah.
Okay. Okay. So how much would you say, how many calories do you feel like you probably normally eat throughout the day?
I don't know. I don't pay attention to that stuff.
Okay. Do you feel like you drink enough water?
Yeah,
Okay. How much water do you drink in a day?
a gallon.
Now, do you have any type of cultural restrictions that you follow? Okay. Okay. So let's just kind of go on and talk a little bit about your bowel and bladder patterns. How frequently do you have a bowel movement?
About every day.
Okay. And then do you have any trouble urinating? So no trouble starting and stopping your stream or anything of that nature?
Mhm.
Okay. And then do you live in town or out in the country or?
Yeah.
Okay. Do you, in your place of work, have any exposures to any type of environmental toxins that you know of? Okay, so no worries about any type of like fumes or gases or anything of that nature. Okay. So you're kind of here for this knee pain that you're having in the right knee. Does that affect in any way your ability to kind of perform your daily activities? Like you're able to easily get in and out of the shower, or is that a problem for you?
I'm getting out just fine.
Okay, so it hasn't affected your ability to take care of your personal needs or things of that nature?
No.
Okay. Okay, so who do you live with?
My wife and my dog.
Okay. And then you mentioned that you had 2 daughters.
Mm-hmm.
Okay. And then how do you, as a family, how do you guys make decisions?
I just talk about it and come up with what's best.
Okay. So maybe some teamwork.
Yeah.
Okay.
We sing the Wonder Pets song when we do it.
Okay. How well do you sleep at night?
Pretty good.
How many hours of sleep do you think that you get?
Between 6 and 7.
Do you awaken frequently in the night?
Have recently. Have an elderly dog that wakes me up pretty frequently.
I see. I understand. Do you take any naps throughout the day?
No.
Okay. Do you require additional pillows or anything to help you rest better at nighttime? Okay. And do you use any sleep aids?
No.
Okay, so let's talk a little bit about your exercise. You mentioned that you run.
Mm-hmm.
How frequently do you run?
2 or 3 times a week.
Is there any other types of exercise that you partake in?
We take walks pretty frequently too.
Okay. Anything else?
Bike during the summer.
Okay, biking in the summer. Let's talk about those leisure activities. What are your hobbies? What are the things that you like to do in your downtime?
All the exercise stuff mentioned before.
Okay. Do you do any travel outside of the United States?
Yes.
Okay. Where do you go?
We go to the Dominican Republic pretty frequently.
Okay. Are you a smoker?
No.
Have you smoked in the past?
Yes.
Okay. But you are no longer smoking.
Right.
Do you drink alcohol?
Socially.
How would you define socially?
Sometimes maybe just 3 or 4 times a year.
Okay. Do you use any street drugs?
No.
And do you feel safe and comfortable in your home environment?
Sure.
Have you had any major life changes in the past 2 years?
No.
No? Okay. Do you have like any tension? Do you feel tense at all?
No.
Okay. So you feel pretty good about how you cope with stress.
Mm-hmm.
Okay. Are you sexually active?
Sure.
And then has anything changed about your sexual health or function here lately?
No.
Okay. Okay, so this last little bit of the interview, we're just going to go through just a review of the different systems in the body. So you're doing great. You're hanging in there. We just have a few more things to talk about. So in general, you mentioned that you've had this knee pain for a while, and then you also are not completely satisfied with your current weight, that you would consider losing some more weight. Is that correct?
Sure.
Okay. Have you had any concerns with your skin? Any rashes, recent lumps, sores, itching, dryness, any changes in your hair, things of that nature?
No.
Okay. So you mentioned that you occasionally have headaches. How frequently do you have the headaches?
Not as frequent anymore.
Okay.
Kind of based on how much water I drink.
Okay. Have you had a recent head injury or experienced any kind of dizziness or vertigo?
No.
Great. Have you had any vision changes?
No.
Any pain in your eyes?
Only when I don't drink enough water.
Okay. Any redness or swelling? And I see that you wear glasses.
Yeah.
And we talked about your last eye exam.
Yep.
Any problems with excessive tearing or double vision,
No.
blurred vision? Okay. How about with your hearing? Any changes in hearing? Any ringing in your ears?
No.
Okay. Any earache? No infections, hearing loss, and hearing aids?
No.
No hearing aids. Okay. All right. So have you recently had any problems with having a cold, congestion, any, stuffiness in the nose, any discharge, itching, seasonal allergies?
No.
Nosebleeds?
No.
Any problems with a change in your sense of smell?
No.
Okay. Do you have any problems with your gums bleeding?
No.
Any mouth pain or toothaches?
No.
Any sores in your mouth
No.
or on your tongue? Do you wear dentures at all?
Yes.
Okay. Full dentures?
Partial.
Partial. And you feel that fits well?
Yes.
Okay. And we talked about your last dental exam. Any problems with dry mouth, sore throat, altered taste? Okay. So have you noticed in your neck any type of tender glands or lymph nodes? You're not having any pain in your neck, any stiffness in the neck, and you're able to move your neck around without any difficulties.
Mhm.
Okay. Okay, and then this is also important for males as well. Have you noticed any type of lumps in your chest? Have you had any sort of rash on your chest? Any surgeries? Any issues at all with your breasts? Any type of tenderness or anything of that nature? Have you had any problems with a cough? No coughing, any shortness of breath or wheezing that you've experienced?
No.
Any pain at all? Okay. And we talked about history of lung disease in the family. Do you have any problems with lung disease?
No.
Okay. And you've not had a chest x-ray? All right. And have you ever experienced recently any chest pain or chest discomfort? Any palpitations? Any swelling anywhere in your feet, ankles, hands? Do you know if you have a history of a murmur at all?
No.
Okay, and you've never been told that you have hypertension?
No.
Okay. And any changes in your appetite? You said your appetite's pretty good.
Mm-hmm.
Any concerns with nausea or vomiting?
Mm-hmm.
Okay. Any heartburn?
No.
Any pain in your stomach?
No.
Increased belching or gas?
No.
Okay. And your bowel habits are fine.
Mm-hmm.
No concerns about any blood in your stool, and your bowel movements you feel are normal consistency.
Mm-hmm.
So no diarrhea and nothing's too firm.
Right.
No constipation. Okay. Okay. So do you have any problems with awakening in the night and having to urinate?
No.
Okay. No urgency. Okay. And no blood in your urine.
No.
Okay. And we talked about earlier how you said that you're not having any problems starting or stopping your stream. Everything seems to be fairly normal with that. Do you have any dribbling?
No.
Do you have a history of any type of hernia?
No.
Any discharge?
No.
Okay. Any masses or pain in your testicular region? And then do you perform self exams?
Mm-hmm.
Okay. And how often do you do that?
About once a month.
Okay. And no concerns.
No concern.
Great. Okay, and then have you ever experienced any coldness, tingling, or numbness, or leg cramps in your lower extremities, your both legs? Okay. Any varicose veins? Have you ever had a history of a blood clot?
No.
And do you have any problems with discoloration of your hands? And then do you have any type of history of open wounds on your legs, feet? Okay. Okay, so now we're going to talk a little bit about your musculoskeletal system. We've talked about how you have this right knee pain. Do you have any muscle pain or cramps? Any other joint pain besides the knee? Any joint stiffness besides your right knee? Okay. Have you been told that you have arthritis?
Yes.
Okay. And when were you told that?
A few years ago, I went to the doctor about it.
Have you ever experienced problems with gout?
Mm-hmm.
Do you have a limitation of movement? Mm-hmm. Okay, so just with the right knee?
Right.
Okay. And you feel that you have a hard time getting your knee to completely straighten out? Okay.
And bend all the way.
Okay. Okay. Have you had any problems with fainting? Have you ever had a seizure?
No.
Any weakness in your arms or your legs? Any paralysis? And you've not ever had any history of stroke?
No.
Any tremors? Any involuntary movements? Do you feel like you have any problems with your coordination? Do you feel like you are concerned about your memory or any mood changes? Okay. And then we've talked already that you are negative for any type of psychiatric history. No hallucinations.
No.
Okay. Have you ever been told that you have anemia? Have you ever noticed easy bruising or like a heavy amount of blood if you cut yourself? And you've not had blood transfusions or reactions?
No.
And we've talked already about no concerns with lymph node swelling.
Right.
And then you've not been exposed to any type of toxic agents or radiation. All right. Are you have any trouble with being intolerant of cold or heat? Have you ever experienced any excessive sweating?
No.
Okay. And we talked about how there's not a history of diabetes, correct?
Right.
Thyroid problems. And then everything seems to be fine as far as hair is concerned. You're not noticing any thinning of the hair or anything of that nature. Okay. Do you experience any nervousness or anxiety? Do you feel like you've ever had or been diagnosed with any type of depression, memory changes? What about suicide attempts? And then we've already mentioned that there's not been a history of mental illness.
Right.
Okay. All right, very good. Well, that includes this first portion here where we've just kind of reviewed your current problem, the reason why you're here, and we've talked about your past medical history, your family history, and your social history, and then just kind of reviewed your systems from head to toe. So then going forward, the next step would be to do a complete head to toe assessment.